How do emotional triggers affect epilepsy seizures? Imagine your feelings are like a storm brewing inside you. For some people with epilepsy, especially those with temporal lobe epilepsy, this storm can actually influence whether a seizure occurs. The brain's emotional centers, particularly the amygdala, play a big role here. When someone experiences strong emotions like stress, anxiety, or even excitement, these feelings can activate the amygdala and other parts of the brain involved in emotion regulation. If these areas are overactive or enlarged, they can make the brain more prone to seizures triggered by emotional stimuli. Stress is one of the most common emotional triggers. When you feel stressed, your body responds by releasing hormones and activating the nervous system. This can increase brain excitability and lower the seizure threshold, making seizures more likely. Chronic stress can also lead to mood issues like anxiety and depression, which are common in people with epilepsy. These mood disorders can further increase seizure risk because they change how brain circuits function and how easily neurons fire. Plus, stress often messes with sleep, and sleep deprivation is a well-known trigger for seizures. Mood swings and emotional changes are also linked to epilepsy. Feelings like irritability, sadness, or anxiety can happen before, during, or after seizures. These emotional shifts can impact quality of life and may even make seizure control more challenging. Interestingly, even positive emotions like excitement or happiness can sometimes trigger seizures in certain individuals, showing how sensitive the brain's emotional and seizure pathways can be. Managing emotional triggers is a key part of living well with epilepsy. Recognizing what specific feelings or situations tend to provoke seizures helps in developing personalized strategies. Techniques like deep breathing, relaxation exercises, or talking to a counselor can help reduce emotional stress. It's also important to work with healthcare professionals to optimize medication and address any mood disorders through appropriate therapy or support. By taking care of both emotional and medical health, individuals can often reduce seizure frequency and improve their overall well-being. In essence, emotional triggers influence epilepsy seizures by interacting with brain regions responsible for both emotion and seizure activity. The amygdala and surrounding areas in the temporal lobe are especially involved. Every person's experience is different, so working closely with medical providers to develop a tailored plan is crucial. Remember, managing emotional health is not just about feeling better. It can also be a vital part of controlling seizures and living a full, active life.